As we grow older, our bodies undergo many changes, some of which are subtle and others more obvious. One of the more easily overlooked symptoms that may be experienced by elderly individuals is chronic itching. It's easy to dismiss this as a minor nuisance, something that comes with dry skin or a harmless habit. However, persistent itching in the elderly is often more than just skin deep. It can signal a deeper health issue that requires immediate attention. This is particularly important because, in many cases, chronic itching can be a sign of an underlying condition that, if left untreated, could lead to serious complications. Understanding chronic itching in the elderly. Chronic itching, medically referred to as pruritus, is a frequent complaint among the elderly, affecting a significant portion of older adults. It is a sensation that drives individuals to scratch, and in some cases, it can lead to serious skin damage, infections, or a general decline in quality of life. But what makes itching so concerning for the elderly is that it is often more than a superficial irritation. It is sometimes a sign that something deeper is happening within the body. As our skin ages, it naturally becomes thinner, drier, and more prone to irritation. This is why many elderly individuals experience itchy skin, especially during winter months when the air is dry. However, chronic itching that does not improve with standard treatments, such as moisturizing, may suggest that there is something more serious at play. In fact, persistent itching, particularly when it affects specific areas of the body, can serve as an important warning signal of a potentially serious health issue. The 5 key areas of the body to watch for persistent itching. Let's dive into the 5 primary areas where persistent itching in the elderly can signal a more serious health concern. By understanding these areas and the potential underlying causes, you can become a more proactive and informed caregiver. 1. Lower legs and feet. A sign of poor circulation. One of the most common and often overlooked causes of chronic itching in older adults is poor circulation, especially in the lower legs and feet. This issue tends to become more prevalent as we age, and it is a problem that can point to underlying cardiovascular issues. In fact, circulatory problems in the legs are far more common than many realize, and they can sometimes indicate serious conditions, such as blocked arteries or heart disease. When blood flow to the lower extremities is compromised, it can lead to several symptoms, including dryness, discomfort, swelling, and of course, itching. The constant scratching of the lower legs or feet is often a red flag that something is wrong, and if left unaddressed, it can lead to even more severe consequences. Poor circulation can result in ulcers, infections, and other complications that can severely affect mobility and overall quality of life. In addition to the itching, if your loved one is also complaining about their legs feeling heavy, sore, or swollen, or if they are taking frequent breaks while walking, these are signs that should not be ignored. These symptoms suggest that the circulation to the legs is compromised and that immediate medical attention may be required. For elderly individuals who suffer from chronic conditions like diabetes or hypertension, the risk of developing circulatory problems is even greater. Diabetes, for example, can damage blood vessels and nerves, leading to poor circulation in the legs. It's important to recognize that poor circulation in the legs can be more than just an aesthetic issue. The lack of proper blood flow can limit the body's ability to heal wounds and fight infections, leading to complications that are far more serious than simple itching. In fact, if untreated, these problems could lead to limb amputation or life-threatening infections. As a caregiver, if you notice persistent itching, along with other symptoms such as changes in skin color, noticeable swelling, or leg cramps, it is essential to consult a healthcare provider. Early intervention and treatment can make all the difference in preventing severe complications, improving mobility, and enhancing your loved one's quality of life. 2. Back of the neck, a warning for spinal and nerve issues. Itching at the back of the neck is another symptom that is often dismissed as a minor irritation. However, for older adults, this persistent sensation could be a sign of something more serious, such as nerve compression or spinal issues. As we age, the spine and surrounding structures tend to wear down and become more vulnerable to various conditions, including arthritis, herniated discs, and degenerative spine disorders. The neck area is particularly vulnerable because it contains a network of delicate nerves that extend throughout the rest of the body. When the spine undergoes age-related changes, such as the loss of flexibility or the formation of bone spurs, pressure can be placed on these nerves, leading to a range of symptoms, including persistent itching, tingling, numbness, and even pain. While itching at the back of the neck might seem like a trivial annoyance, it could indicate nerve compression, which can lead to more severe health problems if left untreated. For example, conditions like arthritis or herniated discs can worsen over time and cause debilitating pain or loss of mobility. Additionally, the itching may become accompanied by other symptoms, such as difficulty turning the head fully, headaches, or a sensation of weakness or numbness in the arms or shoulders. These are all signs that something more serious is going on, and they should not be ignored. Nerve compression or spinal issues often affect more than just one area of the body. These conditions can cause widespread discomfort and affect mobility, making it crucial to address them early. If your loved one is experiencing itching at the back of the neck along with any of these additional symptoms, a visit to the doctor is essential. Early diagnosis and treatment can help prevent the problem from worsening, and in some cases, it may even be possible to reverse some of the damage. 3. Upper back and shoulders, possible liver or kidney issues. Itching in the upper back and shoulders, especially when it is accompanied by other symptoms such as fatigue or yellowing of the skin, jaundice, may signal problems with the liver or kidneys. As we age, these vital organs can become less efficient, and their dysfunction can lead to a variety of symptoms, including persistent itching. In the case of liver problems, itching is often caused by the buildup of bile salts in the bloodstream, which the liver is unable to filter out effectively. Similarly, kidney disease can cause itching due to the accumulation of waste products in the body that the kidneys are unable to remove properly. This itching can be especially noticeable on the upper back and shoulders and may occur alongside other symptoms like swelling, fatigue, and changes in the appearance of the skin. It's important to keep an eye out for these additional signs, as liver and kidney issues can become life-threatening if left untreated. Early detection is key in managing these conditions and preventing complications such as organ failure. If your loved one is experiencing persistent itching in the upper back and shoulders along with any of these other symptoms, seeking medical attention is crucial. 4. Abdomen and groin area, hormonal changes and skin sensitivity. The abdomen and groin area can also be areas where chronic itching occurs, especially in older adults. This itching may be a result of hormonal changes, which can cause the skin to become drier and more sensitive. Additionally, these areas are often subject to friction and sweat, which can exacerbate itching. For elderly women, hormonal changes due to menopause can lead to a thinning of the skin, making it more prone to dryness and irritation. Men may also experience similar symptoms as they age, with changes in testosterone levels leading to increased skin sensitivity. In some cases, persistent itching in the abdominal or groin areas can also be a sign of conditions such as fungal infections or allergies. If the itching is accompanied by redness, a rash, or swelling, it's important to consult a doctor to rule out infections or other skin conditions. Fungal infections, for instance, are common in the groin area and can cause intense itching. In such cases, medical treatment can help alleviate the discomfort and prevent the condition from worsening. 5. Arms and hands, potential skin disorders or allergies. The arms and hands are other common areas where older adults may experience persistent itching. This can be due to a variety of factors, including skin conditions like eczema, psoriasis, or contact dermatitis. Aging skin tends to be thinner and more fragile, which makes it more susceptible to irritation from allergens, soaps, or environmental factors. Additionally, the arms and hands are frequently exposed to the elements, making them more vulnerable to dryness, sun damage, and irritants. If the itching is accompanied by visible changes in the skin, such as rashes, bumps, or redness, it may be a sign of a skin condition that requires medical attention. In some cases, allergies or other environmental factors may be to blame, and a doctor can help identify the cause and recommend treatments. Early detection and proactive care. Chronic itching in the elderly is more than just a nuisance. It can be a sign of underlying health issues that require attention. By understanding the 5 key areas where itching may be indicative of a more serious problem, caregivers can take proactive steps to address these concerns early on. Whether it's circulatory problems, nerve disorders, liver or kidney issues, or skin conditions, recognizing the signs and seeking medical advice promptly can make all the difference in preventing complications and improving the quality of life for elderly loved ones. As caregivers, it is our responsibility to be vigilant, noticing subtle changes in our loved one's health and acting accordingly. With the right knowledge and awareness, we can help prevent long-term health problems and ensure that our loved ones receive the care and attention they need to live healthy, comfortable lives. Early detection and treatment are key, and by being proactive, we can improve the outcomes for those we care about. The role of arthritis in hand and wrist. Itching arthritis, particularly osteoarthritis and rheumatoid arthritis, is one of the most common causes of persistent itching in the hands and wrists. These conditions can affect the joints in the hands, leading to inflammation, pain, and stiffness. Both osteoarthritis and rheumatoid arthritis have distinctive characteristics, but they share one common feature: the gradual wearing down or damage of the cartilage that cushions the joints, causing them to become inflamed and swollen. This inflammation can irritate the skin around the affected areas, leading to persistent itching and discomfort. Osteoarthritis, OA, is the most common form of arthritis in older adults. It occurs when the protective cartilage at the ends of the bones gradually wears down, leading to pain and stiffness. This form of arthritis tends to affect weight-bearing joints like the knees, hips, and spine, but the hands, wrists, and fingers can also be impacted. When the cartilage in the joints begins to break down, the bones may rub against each other, causing irritation and inflammation that can trigger itching in the skin surrounding the affected joints. This itching is often coupled with other symptoms such as joint pain, swelling, and limited range of motion, making simple tasks like gripping objects or turning doorknobs excruciating. Rheumatoid arthritis, RA, on the other hand, is an autoimmune disorder that occurs when the body's immune system mistakenly attacks the lining of the joints. This type of arthritis can cause not only joint pain and swelling, but also systemic symptoms such as fatigue, fever, and loss of appetite. When RA affects the hands and wrists, the inflammation can lead to more than just discomfort. As the skin around the inflamed joints becomes irritated, the constant itching can make the condition even more difficult to manage, especially if the person is unable to relieve the discomfort. In some cases, the inflammation caused by rheumatoid arthritis can lead to deformities in the hands and wrists, making it even harder for your loved one to perform routine activities. Circulatory problems and itching in the hands and wrists. Another major contributor to persistent itching in the elderly, particularly in the hands and wrists, is poor circulation. Circulatory problems become more common as we age, and they can affect blood flow to the extremities, including the hands and wrists. When blood circulation is compromised, it can lead to a number of symptoms, including numbness, tingling, coldness, and itching in the hands and wrists. Peripheral artery disease, PAD, is one such condition that can lead to poor circulation in the limbs. PAD occurs when the blood vessels that supply blood to the legs and arms become narrowed or blocked, often as a result of a buildup of fatty deposits or plaque in the arteries. This lack of proper blood flow can deprive the skin and tissues of the necessary oxygen and nutrients they need to stay healthy, leading to dryness, itching, and even pain. If your elderly loved one suffers from PAD, they may experience a feeling of heaviness or fatigue in their hands and wrists, and you may notice them scratching or rubbing these areas to relieve the discomfort. In severe cases of circulatory problems, the skin may even develop a discolored appearance or become shiny and thin. If left untreated, circulatory problems can also lead to more severe complications, including ulcers, infections, and tissue damage. Therefore, it's crucial to be aware of these symptoms and seek medical advice as soon as possible if your loved one begins to experience persistent itching in the hands and wrists, especially if it is accompanied by other signs of circulatory problems such as swelling, cold extremities, or changes in skin color. Skin-related conditions that cause itching in the hands and wrists. Apart from arthritis and circulatory problems, skin conditions are another leading cause of persistent itching in the hands and wrists. the skin becomes more fragile and sensitive with age, making it more prone to dryness, irritation, and inflammation. This can lead to a number of skin conditions that cause itching, such as eczema, psoriasis, and allergic reactions. Eczema, also known as atopic dermatitis, is a chronic inflammatory skin condition that can cause intense itching, redness, and swelling. It is more common in younger individuals, but it can also develop or flare up in older adults. When eczema affects the hands and wrists, the skin may become dry, cracked, and inflamed, making it more prone to itching. In some cases, eczema may be triggered by environmental factors, such as changes in weather, exposure to harsh soaps, or even stress. The constant scratching can worsen the condition, leading to more severe skin damage and increased risk of infection. Psoriasis is another skin condition that can cause itching, particularly in the hands and wrists. This chronic condition causes the skin cells to grow too quickly, leading to thick, scaly patches on the skin's surface. These patches can become inflamed and itchy, especially when they are located on areas like the hands and wrists, which are subject to frequent movement and friction. Psoriasis can be aggravated by stress, infections, or certain medications, making it important to address both the physical and emotional triggers of this condition. Allergic reactions to medications, lotions, soaps, or other substances can also cause itching in the hands and wrists. Seniors may become more sensitive to certain allergens as they age, and they may experience itching as a reaction to something they are exposed to, whether it be a new skincare product or an environmental irritant. In some cases, the itching may be accompanied by hives, swelling, or redness, which can provide further clues to the underlying cause. The impact of itching on the quality of life. While the physical discomfort caused by persistent itching in the hands and wrists is troubling, the emotional and psychological impact of chronic itching should not be overlooked. For many elderly individuals, the constant sensation of itching can lead to feelings of frustration, helplessness, and even depression. This can be especially true if the cause of the itching is not immediately clear, or if it is linked to a chronic condition like arthritis or poor circulation, which may not have an easy solution. Itching can interfere with the ability to perform simple daily tasks such as writing, cooking, dressing, or even shaking hands. The constant urge to scratch can disrupt sleep, leading to sleep deprivation, which can further affect mood and overall well-being. If the person is already dealing with other health challenges, such as arthritis pain or heart disease, the added burden of persistent itching can compound their discomfort, making it more difficult to stay positive and engaged in life. Seeking treatment for persistent itching in the hands and wrists. When it comes to treating persistent itching in the hands and wrists of elderly individuals, it is important to address the underlying cause. If the itching is due to arthritis, medications such as non-steroidal anti-inflammatory drugs, NSAIDs, or corticosteroids may be prescribed to reduce inflammation and relieve joint pain. In some cases, physical therapy can help improve mobility and reduce the strain on affected joints, which can in turn reduce the discomfort associated with arthritis. For circulatory issues like PAD, lifestyle changes such as regular exercise, a healthy diet, and smoking cessation can help improve blood flow and reduce the risk of further complications. In some cases, medications to improve circulation or even surgical interventions may be necessary to restore proper blood flow to the extremities. Skin conditions like eczema or psoriasis may require topical treatments, such as corticosteroid creams or moisturizers, to alleviate itching and reduce inflammation. In severe cases, systemic treatments such as oral medications or phototherapy may be recommended. Ultimately, the key to effectively managing persistent itching in the hands and wrists of elderly individuals is to seek medical advice as soon as possible. A healthcare provider will be able to assess the situation, perform necessary tests, and develop an appropriate treatment plan to address both the physical and emotional aspects of the condition. By staying proactive and attentive to these signs, caregivers can ensure that their loved ones receive the care they need to maintain their health and quality of life as they age. Conclusion: persistent itching in the hands and wrists of elderly individuals can be caused by a variety of factors, including arthritis, circulatory issues, and skin-related conditions. It is essential to recognize the potential seriousness of this symptom and to seek medical attention when necessary. By understanding the underlying causes of itching and taking proactive steps to address the issue, caregivers can help improve their loved ones' physical, emotional, and psychological well-being.